So let's talk about infection. And infection is an invasion of the organism or microorganism that can cause cell and tissue injury. Injury or damage is part of the infection process. If the colonization occurs with no injury, then we cannot use word or term infection. Pathogenic is a type of infection when we are looking at the microorganisms that have the potential to cause pathology or pathogenesis. On the other hand, opportunistic, when normal flora will become pathogenic under certain conditions. So a good example again is the E. coli infection, which can be considered an opportunistic infection under certain conditions, but in other cases it may be just considered the normal flora of the gut. So the resistance is an important factor here. The resistance of the pathogen to the barriers, to physical barriers, to immune barriers, and also another factor to consider is the number of the pathogens invading the area. Again, for the normal flora to become pathogenic, what has to happen? So of course the barrier has to be broken, like physical barrier, and create a portal of entry, and pathogens should be somewhat resistant to defenses of the host, number of pathogens, and some type of comorbidities that are present in the host that will facilitate the invasion of the pathogens. Infectious diseases are the leading cause of death worldwide. In the United States, sometimes we forget about this, and cancer and heart disease, of course, are leading causes of death here, but overall worldwide, again, the infectious diseases are being leading cause of death. And one of the reasons that the infectious diseases are not rampant in the US, it's the ability to identify and track diseases and control the spread. And of course, Center for Disease Control and Prevention, CDC, can provide the services and is providing the services in the United States. There are many pathogens that may cause infection, and I would like to give a brief overview of those. And bacterial infections may occur as a primary infection or a secondary infection, and when this occurs, person of course is exposed to a pathogen, and we can consider this is a primary infection. Secondary bacterial infection occurs when there is some type of other disease present. It can be viral disease, which may result in bacterial infection afterward. And so let's say we had a nasal obstruction of some kind, and not necessarily viral, or it can be even mechanical. So this can lead to sinusitis, and because of bacterial influx secondary to that. Of course, eustachian tubes obstructions mechanically, or again secondary to other infective organisms, may lead to otitis media. Normal flora again, is the bacteria that occupies the skin, lives on the skin, and usually harmless. And besides the skin, we can see it in intestinal tract, genital tract, and mucous membranes in mouth, nose, and bacteria that is harmless and creates the normal flora can become pathogenic under certain conditions. So when the resistance or body defenses are weakened, this bacteria can certainly take over. Staphylococcus infection on the skin can be very devastating, and also Staphylococcus, if the skin barrier is broken, can enter the organism and virtually infect any organ. Staphylococcus aureus is one of the bacteria which can be very devastating and harmful, and especially the methicillin resistant form, so-called Mrsa or MRSA. And what happened, Mrsa is resistant to penicillin and other antibiotics, and Mrsa is a consequence of widespread antibiotic use and treatment and overuse of antibiotics, mostly in primary care as well as in acute care. Significant number of people with viral diseases such as bronchitis are treated by antibiotics, and which there is no indication for that, such as, again, bronchitis most of the time has viral origin, and signs and symptoms aren't recognized. For instance, if patient has productive cough, and they will say that they have yellow greenish sputum, and chest x-ray will be negative for pneumonia, patient is afebrile, and this everything points on viral infection. However, primary care provider may go ahead and prescribe antibiotics just because of the sake of prescribing and just trying to create a happy patient. But what it really creates, it creates the resistance of the normal flora that can be invasive and become a invasive pathogen and Mrsa. The good news is that in regions that the overprescription of the antibiotics is very low, the Mrsa and other type of resistant infections rates are dropping. So Mrsa, to keep it alive as an infection in the community, the overprescription of antibiotics should occur. So it's important to know signs and symptoms of the viral infections versus bacterial, and the importance of known antibiotic treatment of viral disease. So streptococcal bacteria can normally live on the skin and in the throat. So common infection by Streptococcus will include streptococcal laryngopharyngitis, or commonly called strep throat, scarlet fever, pneumonias, and even meningitis. Some people may develop as a sequela of streptococcal laryngopharyngitis the rheumatic fever and glomerulonephritis. So enteric bacteria in intestines is again E. coli, Klebsiella, Pseudomonas, even Shigella and Salmonella. But E. coli can cause enteritis in infants and adults, and E. coli can be cause of so-called traveler's diarrhea. And traveler's diarrhea, E. coli strain that the local dwellers are not susceptible, but the travelers from other regions may develop diarrhea secondary to that, or some type of colitis. Pseudomonas is notorious for infecting wounds, and the Pseudomonas infection actually will not look very good as any infection, and you will see green exudate, pussy exudate production, and foul odor. Although Shigella and Salmonella usually are not found in the intestinal tract, but Shigellosis can still happen, and Salmonella infection also can happen. And Salmonella actually can cause severe food poisoning, and especially if it comes from the eggs that being contaminated. And of course, eggs inside, the hen eggs or chicken eggs, are not contaminated inside, but the improper handling and processing of those may cause Salmonella infection sitting, or Salmonella bacteria sitting on the shell. So viruses are the smallest infective organism, and I put word organism here, but is it really an organism or a particle? So to be precise, the jury is still out there. It can have properties of a living organism, however it needs another living organism to replicate, and it's really a particle. But for us, like healthcare providers and health educator, important part is really how to recognize and treat. Viral infection, again, viruses need a host cell to reproduce. It's not easily treated. The antibiotics, again, are not effective. But when pneumonia is a sequela of viral infection, of course you need to prescribe antibiotics to deal with the secondary infection. So viruses more or less controlled nowadays, especially those that have been around for a long time, and immunizations are still effective way to prevent certain viral infections such as measles, mumps, rubella, smallpox, chickenpox, and latent viruses may lay dormant in cells and replicate. Of course, varicella can be presenting further in life as shingles infection. And shingles, it's not only disease of elderly people, but more and more, for some reason, you see younger people in their 20s and 30s that will present with shingles. Fungi are different in that fungus is bigger than a bacteria, but is not as deadly or harmful as bacteria. Only very few types are pathogenic. Most of the fungal growth is harmless, and fungus actually plays significant role in nature in restoring the balance in nature, and helping to destroy already dead tissues and debris. But at the same time, there are few fungal infections or type of fungus that can be harmful to humans. So fungal infection of tinea tinea infections are usually living on the skin, and fungus are notorious for choosing a cold environment. And of course your skin isn't cold, but compared to internal environment, skin is much cooler. So tinea infections are commonly, like layman definitions, is ringworm and athlete foot and jock itch. They are very common and very, very infective, and can be transferred from one person to another. So another type of fungal infection is Candida Infections. It's a superficial infection of skin and mucous membranes. In an adult, Candida infection in oral cavity or thrush is not an expected finding. And what in this case oral Candida in an adult or thrush may signify, it may signify immunocompromised status. Children, on the other hand, may often develop Candida, and it may be considered quite expected finding, but in an adult, again, its immunocompromised status needs to be further investigated. On the other hand, again, adult candidiasis, oral candidiasis, may signify even HIV infection, and if there is some type of suspicion that patient may be infected with HIV, certainly further testing may be indicated. Also, Candida infection can cause vaginitis and or a yeast infection, and which is easily treatable. And on the other hand, other fungal infections may cause histoplasmosis, and histoplasmosis is really it can be tied to certain geographic locations and certain behavioral factors, such as having a cat and emptying a litter box, and it's not really common in general population, but still the damage can be devastating. So definitely it's a good idea to advise your pregnant or getting ready to be pregnant patients not to deal in any form, shape, and any way with cats or cat litter. And the best thing will be to send cat somewhere else, or at least to give the task of emptying cat litter box to the significant other or another family member. So fungal infections you can treat with antibiotics and certain antifungal medications. Some fungal infections are extremely difficult to cure, such as nail fungus or even ringworm infections, but it may require long-term therapy, such as nail fungus. You may require the Sporanox pulse therapy and other type of antifungal medication. The problems with the antifungal medications, they may cause liver damage in some cases. But other fungal infections like vaginitis or even candidiasis are fairly easy to treat and cure. Rickettsia is a microscopic organism that's somewhat intermediate between bacteria and viruses. However, like a virus, it needs a living host cell to multiply. It can be spread by a vector organism, which is flea, tick, mites, lice, something that can bite, basically. And the most common disease that may have devastating consequences for your patient, it's Rocky Mountain spotty fever, which is spread by the tick. Your regular tick you may find on the dog occasionally, especially if you go through the woods, not the carrier of Rocky Mountain spotted fever. However, the carrier will be much smaller, and if there is suspicion of the infection of Rocky Mountain spotted fever caused by a tick, the best thing to do after a tick bite to collect the tick and preserve it in some way, and if symptoms occur, certainly present it to a provider for identification and treatment. But again, it's fairly uncommon infection with regular ticks that you can find, the black ticks. The brown ticks, they may cause the Rocky Mountain spotted fever infection. Protozoal infections are caused by single-cell microscopic organisms, and they can be found in the soil, and they live in dead or decaying material. So ingestion of spores or infection can be caused by insect bites. Malaria can be spread by mosquitoes, and it's a protozoal infection, and it's most prevalent, of course, protozoal infection worldwide. And the good news is, in the United States, it's very uncommon. But what happened with malaria, the malarial infection, the protozoa lives in the red blood cells of the host and will cause the destruction of red blood cell. Giardia is another type of protozoal infection, and usually Giardia is not as devastating as malaria and can be caused by drinking infected water, and can cause the diarrhea in infected individual. Good news is it can resolve by itself, or if it's found early, can be treated by antibiotic therapy. Another class of infection is roundworms and flatworms and tapeworms, which belong to class of helminids. The helminids are very common worldwide, but not common in developed countries. Pinworms or tapeworms are the most common helminids in this country, and pinworms are usually causing anal itching, and tapeworms may cause certain symptoms such as pain, diarrhea, and usually they come from inadequately cooked meat, so especially hamburgers. So the good rule of thumb is have the hamburgers well done. So the treatment again can be done by anti-helminitic agents, and treatment is very effective, and this is one of the reasons that these infections were certainly under control in the United States. But with the influx of immigrants from developing countries, it's quite common to have the reemergence of these infections. But the good news is, again, it's very treatable and can be taken under control very fast. Testing for the infection may include testing blood for increase in white blood cells, of course, if we're thinking about bacterial infections and or viral infections. So bacterial infection will cause so-called left shift, and viral infection and right shift. As you probably noticed in your clinical practice, that left shift most commonly observed. Right shift can be observed quite seldom, and left shift signifies the increase in numbers of neutrophils, while right shift is increase in the number of lymphocytes. Another test we're all aware of is culture and sensitivity. Can down for blood or urine, but we culture the invading organism, basically bacteria, and then checking the sensitivity against certain antibiotic. Skin testing is used to determine antibody presence for pathogen, and it's one of the common tests done, and it's the Mantoux test used to determine tuberculosis presence. So basically what we do, we of course do intradermal injections, and we inject antigens of tuberculosis, and if the patient has been exposed to TB and developed tuberculosis antibody, the antibody will attack the antigen and will cause induration. In severely immunocompromised patients, the size of induration is smaller. That's the reason, because they cannot mount immune response. So the size of induration for different categories of population is constantly changing, but currently 15 millimeters is for people who do not have any potential for exposure for TB, 10 is for healthcare workers, 5 for immunocompromised people with HIV. There are many other types of testing for the infections, but I wanted to summarize these three major types. So in general, the immune system will be able to control the invasions of foreign organisms, foreign particles. But however, when the barriers of defense are broken, physical barrier or for some reason inflammation doesn't occur, like for instance with steroids overexposure, or immune system doesn't work, for instance like HIV infection, the infection may occur. Again, many different organisms can cause infection, but most common types are bacteria and virus, and you can diagnose and treat it in many different ways, and immunization is important consideration, especially for prevention of viral infection. However, it's still the treatment can be beneficial for many types of viral infection.